So good evening, everyone. You're very, very welcome to the University of Warwick MSc in Diabetes Care information webinar. We're so delighted to have so many of you on the webinar this evening. So thank you so much for joining us at this very busy stage and in your evening, in your free time, I'm sure. So thank you for joining us. Just to let you know, the running order for today is that our Director of Academic Affairs, Mr. Dermot Brannock, will be having a chat with one of our former students, Kelvin Lim. Hi, Kelvin, who's here with us today.
Hello.
There's nothing better than hearing from an existing or former alumni. It means so much more to hear their experiences on the programme than just hear from us and the University of Warwick. We will then have a brief sample presentation from Dr. Lechman, who's a very serious key opinion leader and subject matter expert in diabetes and endocrinology in Malaysia, and one of our senior tutors in Malaysia. And he'll be talking about really the state of the nation in Malaysia and diabetes care in the area, and injectables, orals and new treatments, and just what are the new advances right now in diabetes care in Malaysia. And then finally, we'll end with a programmatic overview, as I said, that will give you all the frequently asked questions on the curriculum, the tuition fees, the time commitment, and the entry requirements. But in the interim, while we're talking, if you have any questions, please put them in on chat, the chat button in the middle of the screen underneath, and we'd be delighted to answer them. But without further ado, I'm going to hand you over to Dermot to talk to Kelvin about his experiences on the programme.
Cheers, Rebecca. How you doing, everyone? So my name, as Rebecca said, is Dermot Brannock. I lead the academic function for this programme. So delighted to be here. We've had, I think this is going to be our 5th or 6th intake in Malaysia, which we're delighted with. My role is to look after the relationship with the university and with the faculty. So delighted to be joined this evening by Kelvin. Kelvin, do you want to introduce yourself to everyone?
All right. Okay, my name is Kelvin. I've been a pharmacist for the past, nearly 16, 17 years. And I have a special interest in diabetes because I was the one who started MTech diabetes in the government sector. But after I left the government sector, I sort of started my own company, Georgetown Pharmacy. And we tried to implement the MTech clinic in the private sector. So while implementing it, I sort of wanted a way to update myself, to keep myself updated on the current trends. And that's why I enrolled the PG diploma. But the reason why I furthered to master's was because I thought I needed a more in-depth knowledge on how to appraise literature. And that was the main, that was exactly what I got out of the MSc. After doing the MSc, I find myself looking at articles or literature differently. So it's built my critical thinking to actually go through articles in a more systematic and scientific way, I would say.
Brilliant, Kelvin. And as you say, you've gone the whole way through to finish the masters now, and just waiting on the piece of parchment to arrive. But how did you find? I mean, it's a big step for anyone to take a leap back into university and to do a qualification. How did you find the transition from into study?
Well, I think when I was doing the PG Dip, it was more of a time commitment, and it was back to school, and we were learning everything, just like the classroom setting. I liked it a lot, but when you do a PG MSc, it's going to be different. Most of the things will be upon yourself. You're not being instructed to do anything, and you need to plan your timing really well. That's something that I think most of you need to know before you step into it, because nobody's gonna be guiding you step by step. Of course, the tutors will give you suggestions, reviews, which I'm very fortunate to have a very, very good tutor. My supervisor, Katie Reed. Dr. Katie Reed is a really, really wonderful tutor, and I learned a lot from her. But having said that, the whole planning and everything, you need to do it yourself.
I think you're right. I think when it comes to the two elements of the program that I'll speak about in a few minutes are the taught modules, which cover the science of diabetes.
Right. Am I still on? I can't really hear Dermot.
And that's it. Am I broken up?
Okay, now.
Am I back?
Yeah. Yep, I can hear you.
Okay, so sorry about that. What I was saying was, I think the taught modules are, they're very structured, and kind of you follow a well-worn path. The difference when you're doing the independent research yourself is exactly that. You get all the critical appraisal skills you've spoken of, but actually there's a project management piece. There's a there's a project management discipline that you learn from doing a master's, that as well as all of the diabetes specific expertise and the literature and research based expertise, actually the third bit that you get is you get a skill in project management that some people may not have had before. Kelvin, how did you find us working full time, as a clinician, studying part time? How was the balance?
Well, I think I might be having it slightly easier than those doctors currently in critical care, because my time is more flexible, as the company is, I'm one of the shareholders, so I have slightly more flexibility. But having said that, during the COVID season, it was really, really busy as well at work. I think my advice would be to plan ahead with a lot of buffer. If you plan it too tightly, I'm sure that our work will have something unexpected popping out. And I think why I probably succeeded okay was I gave myself a lot of buffer, and I could catch up whenever I needed to.
And I think that's really good advice. I mean, I think the program is designed that people can manage it within their clinical load. But what you're speaking about of finding a finding a rhythm of study and having a plan, and acknowledging up front that life is going to intervene, that there will be times that you have unexpected events, and there'll be happy ones and there'll be sad ones, and that you've got enough of as you say, a buffer built in. But
right.
Did you find it, so you're coming from one clinical perspective. What was it like learning with an interprofessional group? Because the mix that you'll be in with on this program, it is doctors, nurses, pharmacists, it's kind of it's the wider professional mix. How did you find being on a program with a wide kind of international and interprofessional mix?
Definitely interesting, because I had a pharmacist from Dubai, if not mistaken, a few pharmacists from Dubai, yep, and even from doctors from various specialties, like Hiroko is her specialty is really, really specific. So I find that I'm exposed to different roles in the world, and I mean, I'm a person who likes making new friends, so yeah, it's a good experience.
And have you, obviously you had a strong interest in diabetes before you came onto the program.
Right.
How is that translated now after the program into what you're doing
real life
career in real life? Yeah, exactly.
Right. It's been perfect, because I've actually transitioned. I've sold off my company, and I've transitioned into a principal trainer. That's why you saw the name training department there. So I'm heading a team where I get a lot of doctors and myself. We're doing professional development courses for our fellow pharmacists and the housemen. So with the skill and of course accreditation I'm getting, I think it helped a lot in my career this way. And not only that, I think I gained a lot of writing skills in terms of scientific articles, and I'm more confident to publish any articles right now.
And I think that's one of that again, when you look at transferable skills off this program, I think chronic disease management is one. You're learning about diabetes, but actually you're learning about the principles of chronic disease management that are relevant to a whole host of diseases. But also those research skills and that critical appraisal skills, again, that goes across everything. One of the things that I'll show on a slide later on is that the ability to interpret research, that, you know, when something comes out, you will just pick it up, read it, and have a very informed view immediately. You're not going to wait for somebody else's interpretation of what that says, and particularly spotting the type of bias that some organizations that publish research may have.
Yep. Especially right now with the ivermectin issue. Yeah, that's when this research skills have equipped me with enough persuasion power to actually educate my fellow pharmacists in my group.
Which is, you know, it's phenomenal that, you know, yes, you learn about diabetes, but actually there's this whole other ecosystem around the program of stuff that is genuinely beneficial. So look, Kelvin, I'm conscious that I could chat to you about the program all night, but Rebecca's going to nudge me fairly soon to to move on. Rebecca, I think Dr. Letchman is still in the curriculum meeting, so will we do the poll and then move to the move to the program overview section? And you're muted.
We're not doing a poll on this one, Dermot.
Oh, sorry. Okay.
Yeah.
Cool. Okay, so what I'll do, and Kelvin, by all means, don't feel obliged to stay and hear about the program that you've just finished. Yep. So, and look, it's been absolutely brilliant to chat to you again. Thank you so much for coming along. So, what I will do is I'll share screen here, and over the next 20 minutes or so, give you an overview of the program, the structure, and basically everything you need to know to make a decision to enroll or not. So one of the first things you'll see is you're going to see IHEED sitting alongside the University of Warwick. And IHEED, we are an Irish company. We're a division of the Cambridge Education Group in the UK. We were founded by a family doctor in Ireland, and effectively we have worked for the past 8 years. We've been working with government ministries in healthcare to develop particularly capacity in family medicine, but also across a whole range of specialist areas. So what we do is effectively design, develop, and deliver postgraduate medical education. And that is everything from full family medicine residency programs like the MINT-FM program in Malaysia, which we run with RUMC and the Irish College of General Practitioners, right through to, you know, national training programs for health workforces, to postgraduate qualifications like this one. We've over 400,000 completions on our platform to date. So it's the only thing we do, and we like to think that we're pretty good at it. The University of Warwick is a phenomenal university, especially in the field of diabetes. They're ranked 8th in the United Kingdom, and that is, you know, it is a sign of the quality and the depth of research and output and academic outputs and career outputs that their graduates have. They're 62nd worldwide, so, you know, it is as strong a caliber of university as you'll get anywhere. The Russell Group in the UK is the top research orientated universities, and, you know, that again, that speaks to the quality of research output and the quality of academic delivery that they have. In Europe, when you think of diabetes education, you think of Warwick. They are the first people that you think of. They've graduated 14,000 people off their diabetes programs in the last 15 years, and, you know, that is it is based on a huge amount of expertise and know-how and research in diabetes. The program that you get and the qualification that you get is the exact same as any other on-campus qualification that Warwick offers. So the certificate that Kelvin is going to get shortly is going to be a master's in diabetes care from the University of Warwick. It will not mention online learning. It will not mention distance education. It will not mention IHEED. It is the exact same as any other qualification that the university can give. So what the program actually is. So it's structured into 3 semesters, and you've got the first 2 semesters make up a postgraduate diploma, and then the 3rd semester makes up the Master of Science. And it, it is important that it's recognized locally. We work very closely with the MMA in Malaysia. We work very closely with the Ministry of Health in Malaysia, and it is recognized not only academically but also locally. So it's it will stand you in very good stead to have on your CV. One of the advantages, I think, to a program like this is that we bring not just a faculty from the University of Warwick, but we bring a faculty from all over the world. So our program leader, Colin Kenny, he's an examiner for the Royal College of General Practitioners. He was one of the founding committee members of the Primary Care Diabetes Society in the UK. We've got the National Diabetes Clinical Lead for Ireland. Lecheman in EPO is a predominant endocrinologist in Malaysia. Pam Brown is on the NICE Guideline Steering Committee. Ralph is the president of the Primary Care Diabetes Society in Australia, and that's just a selection of the faculty. So it is you get a fantastically international experience. We've tutors on this program from the UK, from the Middle East, from Malaysia, from Australia, and that international perspective in diabetes is really, really valuable. So in terms of actually studying the program, this is an online program, but it is ran very much to the, it is ran using small group teaching principles. So we limit the group size, so there's about 20 in each group, and that sets a capacity for the program. And we maintain ratios of tutors to students all the time to keep the quality of everything we do at the highest level. The taught modules, as Kelvin said, they're really well structured. It's six-week modules for the taught component of the program. And then you move on to do your professional research project with your supervisor. So it's really well paced. And the structure of that lends a lot of flexibility to how you can manage the program. And, we have watched in amazement over the last year as the program has gone on through COVID, and people have, through hardship and times where they've struggled, they've managed to succeed brilliantly. And that is, the program is designed from the outset to be an online program. It's designed to fit in around your clinical commitments. And it's also, it's underpinned by a really, really strong level of support, both from the tutors, the program leaders, and the program management team, who you'll see every week. So, it's, in terms of someone approaching this and wondering, will I be able to commit to it? As opposed to some programs which used to be campus-based and are now online, this has been designed right from the outset to be an online offering, to be flexible, to have strong support, and recognize that everybody on the program is a full-time healthcare professional and a part-time student. And that feeds into everything. So in terms of the actual structure then, so the first semester is all about finding your patients. So module 1, core principles of diabetes, is diagnosis, screening, people that are in a pre-diabetes stage, and giving you a very solid grounding in evidence-based medicine, so that everything you're looking at, to Kelvin's point earlier, you're able to appraise and critique the literature. The second module then is on self-management of diabetes, and there is incredible research on the impact of lifestyle and diet and exercise on diabetes. And the direct study in the UK showed that if you put people on a severe calorie restricted diet, you could actually put their diabetes into remission. Underpinning that is, as a clinician, you having the knowledge and the tools and the techniques to really empower your patient, to give them a sense of responsibility over their living with their condition. And that is understanding empowerment. It's understanding behavior change and resistance to change. It's understanding what education programs can give to somebody. It's knowing the value specifically of physical education, of how you can actually prescribe that as part of a treatment plan. And really, self-management of diabetes is the first step to see how well can the patient get control of their diabetes. We then move on in the third module to treatment. And we take an approach that, the landscape in the treatment of diabetes is changing rapidly, and the scope of practice and what is permitted to be prescribed is changing all the time. And there, in many countries, there is a big push to manage chronic diseases within primary care. So we have taken the decision to focus on all the available treatments, whether or not they're currently within somebody's prescribing rights or not. We will arm you with everything you need to know about the entire range of therapeutic options for diabetes. And then, we will look at things like surgery. We'll look at obesity management, and everything to do with putting people on injectables and how to manage them. So one of the things you'll see in a few minutes is the feedback that we get from participants on the program is, their level of confidence in managing diabetes and in managing the therapeutics of diabetes goes up hugely. So semester one, very much about finding the initial management of them and hopefully getting them to a point where they have good control. The second semester deals with the complications that come alongside diabetes. So we split the complications into two modules, so small and large blood vessel complications. So eyes, feet, nerves, kidneys, etc., come under module 4. And at time of diagnosis, a quarter of people will have background retinopathy by the time you figure out that there's a problem. So being able to mitigate and manage further complication in diabetes is key. Module 5 obviously has a management element to it, and looking at heart disease, cerebrovascular disease, tension, hyperlipidemia, etc. So you really get into a lot of depth on all of the kind of complications that come with diabetes. Module 6 then is looking at special circumstances around diabetes. So gestational diabetes. What do you do if someone is fasting and they have diabetes? What's the impact on sports and exercise? When someone has strenuous activity, what should that do to? What's that likely to do to their levels, and how do they manage it? There is a wealth of literature on the relationship between depression and diabetes, and this is something actually many of our master students have looked at for their professional projects. And then people with diabetes are living longer, treatments are getting better, but it also means that they have far more comorbidities when it comes to later life. So the journey that you go on over the first 2 semesters, really, it follows your patient through from initial diagnosis to helping themselves to all the treatment options that you may need, into managing their complications, and then some of the more specific circumstances that you'll find people in. The master's project then is where, in semester 3, you choose a research idea. So you'll have done 12 months of in-depth analysis of the world of diabetes, and you'll look at something that you say, I want to explore that more, or there's a question here that I want to answer. In Kelvin's case, it was there was a particular drug that had a wealth of literature coming out of China on it, but that wasn't fed through to the English language journals. And so he did a review on the use of that drug and what it could mean. An absolutely fascinating study. Other people have chosen to look at, the impact of diabetes on mental health. They've looked at the use of patient registries. Some people have looked at things like cardiovascular risk disease at time of diagnosis. So, there's an entire range of possible areas that you can look at. And you go through this process in this diagram of, choosing your research idea and reviewing the literature around it, and then figuring out, well, what's the best methodology to answer that research question? Is it a systematic review? Is it a cohort study? Is it that I'm going to do a service evaluation where I work? And you put that into a proposal, you get ethical approval to do it, and then you go off and you do the data collection and analysis. And all the time through this module, you're working with tutors at the start where you're working through your proposal, but then you're working with your individual supervisor. And as Kelvin said, that really, the time commitment and the kind of the look and feel of that is very different than a taught module that you'd have in the first couple of semesters, where this is really where project management comes in, and where you plan out work over a number of months. And the actual, I think it's fair to say, the week by week activity is probably not as intense as the taught modules, but it's very much more an individual journey with you and your supervisor. The output of the masters is phenomenal. So what Kelvin had to produce wasn't a very long thesis that will sit lonely on a shelf. It's a journal article that we hope people have published. So you do a 4,000 word journal article and you do a conference poster. And that is something that is very, very practical as an output of the program. So across the 3 semesters, you're getting, all of the basic sciences of diabetes, management of complications, management of unique circumstances. And then in the research module, you're going into huge depth on the area that really interests you the most, and that you find there's a question that you would like to answer. And at the end of that, you get something of genuine utility, and that can go on your CV, hopefully, as something published. So in terms of how this works, the average age of this program is late 30s, early 40s, and sometimes quite a bit older than that. So it's a couple of years since most people have done formal qualification. So we give you a really, really strong induction into the program and make sure you're comfortable with using the online platform, which we'll see in a minute, and it's very easy to do. All the program regulations, all the supports that are available, and really, before you start module 1, week 1, that you're very, very comfortable with everything about how the program is structured. You then, each week follows a pattern. So if it's the week on retinopathy, it will start with a case discussion online, and we'll put up a case about a patient, and you will input to conversation on that. You then go through, over the course of that week, you go through the online materials, and you go through that in your own time, whenever suits you. And the online content that we have developed is probably some of the best medical education content you will find anywhere. It is really, really interactive. It is very visual. It's full of video. It's full of animation. Speaking of retinopathy, here is, this is, I don't have the sound on, but this is showing you what happens to the blood vessels in the eye with retinopathy, that the cells need to go in single file, and then the impact of diabetes on that. So you get a very immersive experience. You get an experience that is not just pages of flat text or PDFs that you're reading. You get interactive case studies that, it presents real life cases to you. It asks you to make judgment. You get feedback on that. The coverage is really, really comprehensive. As I said at the outset, we don't differentiate between the scope of practice that you have. You will come off this program with as up-to-date knowledge in diabetes as anyone can have. And that's brought to you by absolute world-leading experts. So the week-by-week experience that you have is really, really powerful. But then at the end of the week, so it's usually a Thursday night in Malaysia, we bring you together for a live tutorial. So you will get to know your group of 20 odd people really well. You'll have a different tutor for each module. You'll get to know them very well. And it brings all the content to life. It asks you to discuss cases that you've had. It asks you to discuss where you've encountered difficulties, where you've had problems. Then the assessment is really fair. It's what the assessment is going to ask you to do at the end of each module is to do an essay based on the content of that module and how it relates to your own clinical practice. So it might ask you to look at what the literature says on screening tools for diabetes and how they might be effective within your clinical setting or not. And you can choose that represents your clinic or your city or region or Malaysia as a whole. But either way, it's looking at how do you contextualize the course content in your own clinical practice. And ultimately what this program is trying to do through the type of case studies we'll present you with and the type of information we will give you is enable you to make better clinical decisions. So it is based in the latest evidence, but it's also, it's a very patient-focused program. There's, as I said, there's a whole heap of support behind this program. Stephen Lawrence and Colin Kenny are our program leaders. The tutors are phenomenal. You'll have tutors from all over the world. They are massively dedicated to the program. The program management team you'll meet each week. So there will be someone from the IE team on every tutorial that you have every week. And the student experience in this program is incredibly strong. We've had in the last 3 years, we've had over 500 students, 36 countries. There's 88% student engagement, and that is, I think, an incredibly strong statistic. And when I look at that alongside the first-time pass rate, it says a couple of things to me. One is that we've designed the program such that most people can get to most things most of the time. But also that it's okay to miss a couple of things and still succeed on the program and still have a very positive experience as you go through. So, I think as a learner on the program, you'll have a hugely positive experience. In terms of actual impact, so we do, pre and post program surveys, and you can see the blue here in the is before and the green is afterwards. So, by the time you're approaching your third semester, your confidence levels in the management of diabetes and, things like helping someone to overcome obesity, that's still going to be challenging, recognizing emotional distress. But, the ones around prescribing for cardiovascular risk prevention, initiating someone on injectables, knowing when to refer, all of those are, you come away amazingly confident. And to Kelvin's point, there's a huge positive impact on patient care. There's also an impact on your career, your reputation with colleagues, and your understanding of research papers and clinical trials, and just being able to pick up literature yourself and form a view of it. So in terms of coming onto the program then, so the entry requirements are, one, that you have evidence of proficiency in the English language. That is not a formal IELTS test or an English language proficiency test, and English is one of the official languages of Malaysia. So, there's never a problem with people getting onto the program. We will ask you for a personal statement, and that'll satisfy the need to show evidence of proficiency in English. The program is patient orientated, so you do need to be in a clinical setting, and that involvement in a clinical practice, be it pharmacy, be it primary care, be it secondary care, is really important, that you can contextualize the program content. you need a health science degree. So an undergraduate degree is a requirement to go onto the program. So what we will ask you for then is a copy of your degree, personal statement, 500 words as why you want to come onto the program and a bit about your background. And that is as much to make sure that the program is the right fit for you as you are a good fit for the program. We'll ask you then for an employer or an academic reference. That is simply saying, you're a healthcare professional in good standing. So nothing complicated there. And then we'll ask you for identification. I've said a couple of times, we group this program into groups of about 20, and maintaining the quality that you get with small group teaching is really important. So we do have deadlines for each intake. So the program fills up, and then once it's full, it's full, and it tends to get oversubscribed. In terms of the fees, so you can see the fees split into three. The MSc fee is £9,000, the postgraduate diploma is £5,000, and the postgraduate certificate is £3,750. If you enroll if you register for and if you register and pay early for the MSc, there are significant discounts available, and this price is considerably lower than the book price of the program in the University of Warwick. We have a fantastic relationship with the Malaysian Medical Association, and we're delighted to be able to offer this program at a very substantial discount to what the university would normally charge for it. When you're paying your program fees, you can either pay, obviously you can pay up front, you can pay by semester, or you can pay monthly. And the education advisors who you'll be talking to about enrollment, they will guide you through all of that. But you can see the early registration there, it's as it suggests, an early registration. So that offer there is valid for the next 2.5 weeks till the end of the month. So if you are considering coming onto the program and you do want to avail of that level of discount, then signing up early is a good thing to do. So I am almost done, Rebecca. So it is a 22-month program, 12 months taught module, and then 10 months doing your professional project. As I said, the spaces in this program fill up. The October intake, the autumn intakes are usually a bit more popular than the spring intakes. They tend to fill up a bit quicker. So if you are interested, the advice is to apply earlier. What you get from Warwick, it's a top 10 UK university. It's one of the top universities in the world. It's recognized within Malaysia. What maybe doesn't come across as well in these presentations is how enjoyable the program is. You're learning with a bunch of really enthusiastic colleagues. You're learning with a bunch of incredibly passionate tutors, and it is a pretty fun experience to go through. So Rebecca, I'm going to stop screen share here and see what's going on in chat.
Yeah, so Dermot, first of all, obviously we have to hand over to Lech in a minute for the presentation. Yeah. But just before we do that, Benazir, who's one of our doctor participants, now obviously Kelvin is a pharmacist, but just to be very honest, the vast majority of the participants and students on our program are GPs, or family physicians, or have a physician status. So she is on with us now. If you wanted to ask her, just from her perspective as a former student on the program, and from a doctor's perspective, how she found the program. Hi, Benazir.
Hi, Benazir. How are you?
You just unmute yourself there, Benazir. Can you unmute? You are a co-host, so you should be able to unmute, no problem. Yeah.
Yeah.
Hi.
Hi.
Thank you so much for joining us, Benazir. I appreciate how busy you are at the moment.
Thank you for considering me to come along and share my experience with my other colleagues, new people joining in. I'm sure they're all going to enjoy as much as I did.
I appreciate it.
Benazir, how have you found the program has changed your patient management? I suppose that, the ultimate value of a program like this is, has it changed patient care for you?
To be honest, for me, it has changed a lot for me. So before joining the program, I thought I'm a practicing GP from UK, and then I moved to Qatar, and I thought I knew my bits and pieces about diabetes, but
yep.
I would say that after enrolling on the course has been an eye-opener. So there's so much details and there's so much to learn in diabetes. And I think the most rewarding thing is before I used to see a complicated diabetic patient, my heart would sink. But now I have the confidence to I actually now encourage and take on all the complicated diabetics and start working with them and follow them regular. And once I sort out the HbA1cs and all the other problems, it's very rewarding.
That is, it's funny, that's probably one of the most common things we hear from people, is that actually you seek out the challenging cases that you would have, not relished the prospect of. That it's it's the I suppose the sense of achievement that you get from getting those more difficult patients into a better place is fantastic. And you've had a very international career. How have you found the mix of different perspectives on the program? Because again, it's one of the things that we've taken an amount of pride in, is that you do get a really international experience.
Yeah, I think that it's been really geared for international students or doctors like us. So even the patient scenarios that we have on the learning website, they are Arabic people, and it takes, even the modules teaches you about Ramadan and fasting and Hajj. So I think it's really incorporated the need of the Gulf doctors with respect to managing diabetes very, very well. Yeah,
and it's interesting you say that, because what we have done is the emphasis that you'll see will be very Middle Eastern. The emphasis that the people in Europe will see will have a slightly different slant. And I think being able to have that international perspective, but also bring it that it's got local relevance, it's really important. And how have you found the assessment? Because that's something that a lot of people, if they're thinking about coming on a program, that's the bit they're probably going to be nervous of, is what are these essays like? What's it like actually having to do that side of it?
Yeah, I think that it's the same for me when I enrolled on the course, because I would so what my last learning my exam was 10 years ago. So I did a diploma in 2009, and then having almost 10 years of doing nothing, then I get enrolled onto this diploma. So I've not done any academic writing or no experience at all. But I must say, I think the truth is, once you start learning, it gets better every day for you. I would say in terms of support, there's a lot of support around. So there is a session how to do critical writing. So they tell you the basics, and then you learn as you go along. Plus, with every essay question, the teacher can guide you and just explain you the way how to answer, what are the things, just to make sure you're heading in the right direction when you're answering. So it's not like you're given a question and you just you're alone dealing with it. So there's a lot of support around. So I think even though it was not easy for me, but I managed well.
No, and I think that's a really good summary. It's not easy, but it is really well supported, and that being able to submit a draft of where you're at and get feedback that actually you left out that bit, or you need to put more focus there. That is really important, because most people will not have been doing any academic writing for years before they come on this program. And the other piece that I think is is really important, is that sense of being able to reach out and just ask people for help. And, you know, when you do want the support, that it's there. In terms of, you know, sorry, I've lost my train of thought. In terms of the relationship that you have with your tutors, I mean, do you have a sense of being in a group? And one of the things I would have always criticized on online programs is, you know, you can sometimes feel a little alone. How have you found the camaraderie on the course and the kind of the group dynamic?
No, I think the group dynamics actually worked very well. So even though we're only meeting for an hour, but that hour itself is very interactive. So you have a lot of interactions. There's a lot of question and answers. We get to say what we need to say. We get to ask what we need to ask. And the tutors, I must say, each and every tutor on each module has been brilliant. They are very, very knowledgeable, and they are very, very supportive.
Brilliant, brilliant. Benazir, look, thank you so much for inputting this. I think it's
We sincerely appreciate it, Benazir. Thank you so much.
Okay.
Okay, are we going to hand over to Dr. Letchman now?
That would be great. Hi, Lech. Thank you for joining us. Sorry for the delay there.
Okay. Hi. Thanks for inviting me. And hi, everyone. This is a very odd times that we are in this COVID-19 and we are doing this on Zoom. But, you know, when I got involved in this teaching about 2 years ago, and at that time, Zoom was very new to me. But the reality is we are in a situation now where this is the way to learn. And chances are that we will continue to do this for a long time. And it was, as one of members of the faculty, it was very good for me because you had a chance to, at the same sitting, have students from different continents, actually, and seeing the different challenges, the differences, as well as the similarities, what we all face. The reason to do it is, I think, as doctors, we always want to improve ourselves. And diabetes, even though we are all talking about COVID everywhere now, the fact is diabetes has not gone away. Yeah. It is there and it needs addressing, and more so, I think, more now than ever before, the primary care becomes very important. I'll just share with you some slides that is from a registry to see where we are with regards to diabetes control.
I think that's on the last slide, Lech.
Yeah, I know, I'm trying to make it go. Yeah. No, Zoom have a lot of your RAM.
Brilliant. Okay.
So this I got it from Dr. Faizul, the Registry of Diabetes among the primary care clinics in Malaysia. We already have, as you know, a lot of guidelines, but you know how well we are doing, you could see to some degree from this registry. I'm sort of, it's not moving.
Is it?
Let me stop sharing, please.
Yeah, no, we were on your slide there. We could see it.
Maybe I won't, I'll just use this. Is that all right?
Yeah, perfect. Perfect.
So I wanted to highlight that, you know, diabetes, which comes under NCDs, non-communicable diseases, and the rest, and this is also with cardiovascular diseases, contributes for about 73% of all deaths, together with hypertension and CVD. So it's a big burden for us. Oops, it's not moving. I am not sure why. No, I'll stop sharing again, but now I'll go through. The fact is that among adults above the age of 18, 1 in 5 of our adults population has diabetes. So the burden is a lot, and we need a lot of healthcare personnel to be involved in diabetes to make a difference. Now, the slides I was going to show will also illustrate that in the government clinics, we are doing well. We are taking the BP, we are checking the blood sugar from time to time. But we are not so good in checking the eyes, checking the feet. We are good in taking the cholesterol levels. We are good in checking the renal function from time to time. But the actual degree of control that's obtained, we've been at HB of 8.0 for a long time. We've not been able to push it down further. In terms of complications, even in the primary care, we have a significant, about 5% of the people already have a below knee, sort of some amputation, either below knee or some digits. So we have significant disease because of diabetes. One of the things that's exposed here is that a section on chronic care model. And there are about 6 features of that chronic care model. One is that there should be a support group. There's an online system to keep track of people getting the right thing. And of course, having this registry. But one of the 6 is that the practitioners, whoever is giving the care, should be well trained or continuously be trained. And I think you know that, and that's why you are here on this course. And part of this chronic care model, there's been some studies done in Malaysia. There's one called the COVID study, where they looked at a structured way of managing diabetes with a lot of support. And they actually showed that the care was better in the group of clinics, which was in the COVID group. So what I'm trying to say is that learning systematically the whole of the important things in diabetes, being confident how to manage his patients will go a long way. I think I'll end there.
Yeah, no, that's absolutely brilliant, Lech. And I think the bit to me that you've highlighted is earlier intervention by better trained clinicians is going to lead to obviously a better quality of patient care, a better experience with those patients, and ultimately that it's quality of life, but it's also cost and burden to the health system. And what we see in an awful lot of jurisdictions is there's a huge amount of diabetes management that's being carried out in hospital-based systems that should be managed in primary care, and the patient would have a better experience. It would be more efficient and more effective. And I think that's what if I go back to the modules on this program, that you're giving somebody a really, really comprehensive overview of everything that they need to see within diabetes. So we're finding them hopefully at a much earlier stage. We're treating them at a much earlier stage to try to eliminate or minimize the impact of these complications.
So that's important, Dermot, but I also like to add, you learn from your other colleagues on the course that all of us see a range of patients, right? Yeah. From those very early to very late. And even when we see the late patients, based on the content of the course, you will still have something to offer. I think our primary role is not to cure everything, but for the patient who comes in front of us for a problem, we want to make it better. And you can do that at whatever stage.
That's it. And, you know, Colin Kenny, our program leader, he has a very good say, you know, it's not adding years to life, it's adding life to years. You know, you want to improve the quality of that patient at whatever stage you meet them. And, you know, sometimes that will be quite far down the road, and other times it'll be really early. And I think you're right. You can pick up this content and apply it. And to me, it all goes back to, you know, a better trained workforce. And the point you made on COVID-19 is absolutely valid. You know, we know we are storing up a problem with chronic diseases and, you know, that's everything from cancers to diabetes, because we focused almost singularly on managing COVID. And again, the more that a doctor in the community is able to spot and manage and treat, the better that outcome is going to be.
Sure, absolutely.
Pretty, Rebecca, I'm really conscious of time. That
yeah, guys, I just don't want us to go over, because I appreciate that there's a lot of physicians and clinicians on this webinar that will have very hectic schedules, and it's late in the evening in Malaysia. It's not so late here; it's just coming up to lunchtime. So I just wanted to synopsize really. Dr. Lechman does have a Monash background on today, so just in case people are confused, Dr. Lechman is a professor in Monash as well, but this is a University of Warwick program. And just to let you know, the University of Warwick and Monash University have a very, very close strategic alliance, particularly in the area of research, with a 50 million research contract between them. So they are partnered at a very high level for academic research. So there's a very close alliance between the University of Warwick and the University of Monash, just in case you're very confused and scratching your head there. And just I suppose one of the most important points I would like to say at this stage is that Diarmuid said it previously, but just because it's an online program does not mean that we just enroll without ad infinitum, without actually having a cap. We have a cap in each jurisdiction in each time zone that we never go above, and it's 30. And we do often and habitually oversubscribe. So if you are interested in the October intake, I would say go ahead and apply, make your application and pay your deposit to secure your place, and to make sure you get that significant discount, because it is significant, rather than paying the full price in September, for example. I will say as well that, I don't know, Diarmuid did say it, but the global price for this programme in the United Kingdom and across the globe is 12,000 sterling. And because of the Malaysian Medical Association, the scholarships that we have given in Malaysia, it is 4,000 sterling, and the difference for clinicians in the country, in the Malaysian region. So it is a significant reduction, and we're happy to do so because we've had the most excellent participants from Malaysia on the programme. We want to continue to see those participants coming on in future programmes. So our education advisors will be reaching out to you. You will receive an email with a recording of this event and with an application link and with a deposit link. But also our education advisors, a full team, will be reaching out to you in person to ask you if you have any other questions, if you need assistance with the application process, and if you want to progress to the next October intake. So I think that's it. So thank you so much.
Yeah, thank you so much to Dr. Lechman, to Dr. Benazir, and to Kelvin for their input as well. It's brilliant to get everyone's.
Thanks, Benazir. We really appreciate it. Super. And hope to see you soon on the programme. Thank you so much for.
Thank you so much, everyone.
Take care. Bye.
All right.